This is Doug Field, the CEO of the Institute for Healthcare Consumerism, and thank you for joining us here on IHC TV, being shot at our IHC FORUM and Expo here in Atlanta, Georgia. And joining me today is the CEO of Tango Health, Todd Praisner. Todd, nice to have you here.
Thank you for having me, Doug.
Yeah, give our audience a little background on Tango Health, if you would, please.
Yeah, so Tango Health is an Affordable Care Act compliance provider. We do fully outsourced Affordable Care Act compliance for our large employer customers.
So ACA, thousands of pages of law, very complex. So what are, if you distill it down to 3 or 4 of the most important issues employers are facing, what are they?
Yeah, so we have a range of employers, all sizes, all industries, covering about 2.5 million individuals, so a couple percent of the U.S. workforce. Consistently, the issues are data. The Affordable Care Act data comes out of systems that were not designed for the Affordable Care Act, right? You look at payroll data, HRIS data, COBRA retiree, dependents, leave of absence tracking, which is a new requirement for the ACA. So thing one, data, getting it out, getting it coherent, making sure you can use it for the purposes it's intended for. Thing two, there is not an Affordable Care Act expert on your staff. We have employers who have sort of embraced these myths around the Affordable Care Act and how to calculate 30 hours. You really need somebody who knows exactly how the law works. And third, it's a couple, 3 people to do this job right if you're a large employer and they don't have that extra resource.
So what type of employers had the most difficulty?
So there are a number of employers that have challenges. First off, I don't care who you are, this is hard, right? The Affordable Care Act is not easy for anybody. Ironically, hospitals have a really big challenge. They've got a workforce that is really on demand, on call, working odd hours, long hours, double shifts, no shifts, picking up shifts. They also have procedures that are billed by a procedure basis, and you're paid when you do a certain procedure versus a number of hours. Universities and educational settings have their own special rules. Airlines have rules for flight crews that are on layover. So there's any number of unique industries, but the thing they all have in common is this is hard for everybody.
Yeah. So when you talk about the big companies, 100,000 employees, big challenge, massive challenge.
Absolutely.
What are some of the most complex challenges they deal with?
So when you get to that size, you didn't get there organically. You bought some hospital or you bought some defense contractor. And what happens there is you end up with your systems of record. You get a new payroll system. You get a new ben admin system. You inherit legacy things through M&A. The Affordable Care Act drives your liability backward in time when you buy a company. So you've got those kind of things. Then you have special situational challenges like engineering companies that are trying to groom talent by using co-op programs and internships to bring engineers in out of college and work for a semester in between semesters they go to school. The Affordable Care Act did not address those people, right? So nobody's ERISA attorney or reader of the law can find what to do, and we had to wait for the IRS to provide guidance on how you treat those interns, which turns out to be like seasonal employees.
So you've got big date coming up, the IRS transmission due date.
June 30th, it's coming.
Yeah, how are your clients faring as we move closer
So
to that?
our clients are in pretty good shape. So Tango is one of the few vendors that's directly connected to the IRS automated information return system via our solution. So for our clients, it's going to be another day. It's all about getting your data right, you deciding that you agree with our interpretation of your data, and then it's going to be a non-event when you submit to the IRS. If you're trying to get connected to the IRS right now, you're going to be late. That's where you are.
How did the extension affect your clients?
So our clients were mostly ready to go when the extension was announced, which was the week between Christmas and New Year's. Kind of, I guess they tried to slide it out while everybody was on vacation. They gave you an extra 60 days to get forms to your employees and an extra 90 days to do your electronic filing. We guided our clients to hold off on their documents for a good chunk of that delay because the IRS is still now coming out with guidance. In a kind of a ha-ha funny thing, 2 weeks ago the IRS decided they didn't like apostrophes anymore. So everybody who was trying to submit with apostrophes in their last names, if you're from Ireland and you have an apostrophe in your last name, no apostrophe for you. So there's a lot of guidance still coming. So our advice is wait long enough that you can be comfortable there's no more guidance, but don't wait until the very end when everybody else is rushing for the exit.
So stay focused on 2016 and 2016 reporting. What are the 3 most important things employers should be thinking about?
So number one, you've gotten some reprieve from the IRS with this relief on timing. Unfortunately, you've eaten up half of 2016 with it.
Yeah.
So employers are not really paying attention to 2016 like they should be. Number two, the threshold for compliance is moving from 70% offer of coverage to your full-time employees to 95% in 2016. In our customer base, a third of our employers have one or more federal employee identification numbers that didn't meet 95% in 2015. Now we're working with those clients to make sure they do meet it for 2016, but if you were at 70% for 2015, there's no guarantee you're going to be at 95 for the next year. And then third, the IRS has got to start looking for money.
Can't let you out of here without talking about Cadillac tax. It's coming,
Yeah.
or maybe people think it's not coming. So what is the general feeling among your clients?
So we certainly have a number of clients who have their head in the sand and would like it to just go away. But I would say the top 10% of our client base is actually using the Cadillac tax proactively in their business. And here's a very interesting story. We've got a large 70,000 person employer who knew that they had Cadillac tax exposure because they offer pretty rich POS plans, specifically in California and Texas and in the Northeast. And their CFO got heavily involved in the Affordable Care Act because he doesn't want to be putting in his 10Qs that they're voluntarily paying Cadillac tax. Yeah. So he gave his team guidance, hey, we got to get this Cadillac tax thing sorted out. We need an initiative to get voluntary enrollment up in our high deductible health plan. So they engaged Tango along with not just the requirement for Affordable Care Act compliance, but helping them get their employees into those plans. And we took that employer from 14% to 52% adoption of their high deductible plans. That CFO gets to report $106 million in increased bottom line earnings. That's a pretty big deal.
Yeah, pretty
so again, that's not too bad for a little compliance mandate.
That's a very Todd, it's been great having you on the program. And what are some final thoughts you'd like to share with our viewers?
So again, the Affordable Care Act is hard. If it was easy for you, you're not paying enough attention to it. You don't need to use Tango, but you need to pay attention to it. And if you want to use Tango, you can find us at www.tangohealth.com.
Todd, thank you so much
Doug,
for joining us.
Thank you.
I really appreciate it. And to our viewers out there, appreciate you spending this time with us on IHC TV.